As I blogged previously, and check out that link embedded below, CagriSema is the first combination treatment of an amylin analog, cagrilintide, and a GLP-1 semaglutide, also known as Wegovy, that has been explored in phase 3 trials. 3 trials now evaluating CagriSema in people with type 2 diabetes have just been published, so let's talk about those today. In the Reimagine 1 study, 189 adults with early type 2 diabetes on no diabetes medication were randomly assigned to receive CagriSema 2.4 milligrams, CagriSema 1 and 1 milligram together, or placebo for 40 weeks. At the start of the study, baseline A1C, which is the diabetes report card, was 7.8%, and BMI was 35.2. For people who took treatment as intended, with CagriSema at the highest dose of 2.4, there was an A1C reduction of 1.8% with a weight loss of 13.8%. With the CagriSema dose of 1 milligram each, there was an A1C reduction of 1.5% with a weight loss of 11.8%. And with placebo, the A1C actually went up a little bit, 0.1%, with a very small weight loss of 1.4%. 92% of people completed study on treatment, which is excellent. This study allowed flexibility in dosage to find the best dose for each patient, which reflects what we do in real life practice. Both doses of CagriSema improved other metabolic health parameters, including systolic blood pressure and cholesterol. The most common side effects were gastrointestinal, most commonly nausea, occurring in 53% of the higher dose CagriSema group, 44% in the 1 milligram CagriSema group, and 20% of the placebo group. Most of these side effects were mild to moderate and had onset during dose escalation. Okay, let's now talk about the second study, which is Reimagine 2. And as a disclosure, I am an author on this publication, and also I was an investigator in this trial. Here we're provided the opportunity to compare CagriSema versus each of its components, cagrilintide alone and semaglutide alone, and versus placebo. So we randomized over 2,700 adults with type 2 diabetes who were on metformin and or an SGLT2 inhibitor already for treatment of their diabetes. Average age here was 57, baseline A1C 8.2%, baseline BMI just over 35, and baseline weight just over 100 kilos. These people were further along in their diabetes journey than in the Reimagine 1 trial that we just talked about. Here, the average duration of diabetes was 8.5 years. At 68 weeks, we found the following. With the higher dose CagriSema 2.4 milligrams, A1C reduction was 1.9% with weight loss of 14.2%. With semaglutide 2.4 milligrams alone, that's Wegovy, A1C reduction was 1.75% with a weight loss of 10.2%. With cagrilintide alone at 2.4 milligrams, there was an A1C reduction of 0.8% with weight loss of 8.4%. Now, if we go to the lower dose of CagriSema 1 milligram, the A1C reduction was 1.82% with weight loss of 12%. With semaglutide 1 milligram alone, that's what we know as Ozempic, A1C reduction was 1.54% with a weight loss of 7.5%. And finally, with placebo, A1C went up a little bit, 0.09%, with a small weight loss of 1.5%. So, putting all that together, there was a little better diabetes control with CagriSema versus semaglutide alone, and there was substantial additional weight loss, 4 to 4.5%. With cagrilintide 2.4 milligrams alone, there was also a nice A1C reduction and weight reduction. And that's highly relevant because cagrilintide is being explored as a standalone treatment for weight management. In terms of tolerability, there was a little more in terms of GI side effects with combination CagriSema versus semaglutide alone. Cagrilintide alone was quite well tolerated. At the end of the study, 88% of people were taking treatment. And again, here the dose was flexible to find the right dose for each patient, which is what we do with weight management medications and diabetes treatments in clinical practice. Okay, let's now talk about the third study, which was the Reimagine 3 study. So this was including 274 people, and they had a longer duration of diabetes, about 15 years on average, and they were already taking insulin to treat their diabetes before the trial started. They were randomized to receive CagriSema at the higher 2.4 milligram dose versus 1 milligram dose versus placebo. So here the baseline A1C was 8.8%, BMI was 31.6, and almost half of patients identified as being of Asian ethnicity. At 40 weeks, with the higher dose CagriSema 2.4, there was an A1C reduction of 2.3%. with a weight loss of 12%. With the lower CagriSema dose of 1 milligram, there was an A1C reduction 2.1%, with weight loss of 10.4%, and with placebo, A1C went down by 0.7%, with a small weight gain of 1.1%. Now, the average insulin dose in the CagriSema groups decreased by 2 units. In the placebo group, the average insulin need increased by 18 units. So in other words, CagriSema facilitated better diabetes control with substantially lower insulin needs than the placebo group. As for the other 2 studies, also in this study, most people on CagriSema completed treatment 86 to 89%, again at variable, flexible doses, and gastrointestinal side effects were most common and more common with higher dose CagriSema. So the bottom line here is that CagriSema has proven beneficial to improve A1C, weight, and metabolic health in people across the spectrum, from very early type 2 diabetes to people with a long history of diabetes on insulin therapy. It'll be really exciting to see what other health benefits may come to fruition with CagriSema therapy in people with obesity with or without diabetes, including ongoing studies in cardiovascular disease, chronic kidney disease, and type 2 diabetes, peripheral neuropathy, and for potential bone preservation during weight loss. As a disclaimer, I am an investigator in clinical trials of cagrilintide, semaglutide, and CagriSema. I receive honoraria as a continuing medical education speaker and consultant from the makers of cagrilintide, semaglutide, and CagriSema, which is Novo Nordisk.